Hi. Yeah, could you just give me a moment? I'll just make a note and I'll be right there for you, okay? Yep. Just a moment and I'm all yours. Right. Okay. So, how can I help? Okay. So, your first time here? Right. So, you want to register in our sleep clinic? Yep. Alright, that's great. So, you've been having some problems with your sleep, right? Okay. Yeah, I know it's not a good thing, and it's very good that you came to us, and I think our very qualified doctors, they can help, but first I need to we will need to fill in the form together. So I'm gonna ask you some questions, some simple questions like your name and some questions that are related to your problems with sleep, and after that this form will go to the doctor, and then you'll wait a little bit, and then you can see a doctor today, or we can choose another time, so he will be ready and he will work with you with your problems, and he will know, or she will know what to do, how to help you, right? Okay, does it work for you? Awesome. So it's gonna take some time, maybe 20 minutes, 15-20 minutes. Is that okay for you? Beautiful. Right, so just let me prepare my form. Okay. Alright, so first, could you give me your name, please? Could you spell that for me? Okay. And how old are you? Okay. So you're female. Could you give me your date of birth? Okay. And your race, please? Right. What's your marital status? Are you married, divorced, widowed, or never married? Right. I'll need your home address as well. Okay. Could you spell the name of the street? Okay. Right. Let's see. Do you know the code? Yeah. Beautiful. Thank you. Your phone number, please. Okay. And your email as well. Okay. Right. Great. Alright. How did you hear about us? So your GP referred to us. Could you tell me the name of your GP? Do you know how to spell it? Alright. Okay. And what clinic does she work in? Were you registered? Yep. So you are enrolled in this clinic. Good. Okay. Now we're gonna talk about your sleep problems, if that's all right. So I'm gonna name some sleep problems, and you're gonna tell me which of those you've been having. Okay. All right. Overall sleepiness and feeling tired. All right. Snoring. You're not sure. Okay. Difficulty falling asleep. Breathing stops during the night. Okay. Bed partner making you sick. Difficulty staying asleep during night. Is there any other problems that you would say that are connected to your sleep? Nightmares. Okay. Could you describe for me your sleep problems that we talked about before? Alright. Yeah. It's awful. I know. Okay. I see. And how long have you had these problems? Around 6 months. Okay. Could you please, have you ever had any professional evaluations or treatments for your sleep problems? You did. Okay. So could you tell me now if what was and was not helpful? All right. Okay. Okay. All right. I see. Okay, my next question. What have you tried on your own to improve your sleep, and was it helpful? All right. Okay. Yep. Okay. See. All right. Now, my next question is, so I will name some of the activities, and please tell me any that you do in bed. Okay. Read, watch TV, phone, watching something on the phone as well. Yeah. Okay. Eat, talk on the phone, right? Listen to music, write, argue, worry, watch the clock, use computer. All right. And how many pillows do you sleep with? Okay. All Alright. Is your bed and bedroom comfortable, dark, and quiet? Okay. Do you do shift work or work during the night? Okay, yes. Could you tell me your employer, if that's okay? Yeah. Okay. And what is your occupation or your job title? Alright, I see. Who do you live with and sleep with? I know this is important, yeah. Okay. So you're okay. Do you do any exercises? Alright. What types of exercise do you do? I see. So it's mostly yoga, right? Yeah. How often? Per week. Okay. See. Could you tell me your current height and weight, if you know? Alright. Do you happen to know what was your weight a year ago? Okay. And 5 years ago? Just approximately. Okay. Alright. So next, we're gonna check your sleepiness. So how likely are you to doze off or fall asleep in the following situations, in contrast to just feeling tired? So we're talking here about your usual life recently. Even if you have not done some of these things recently, try to work out how they would have affected you, okay? So they're gonna be 4 types of answers: would never doze, slight chance of dozing, moderate chance of dozing, or high chance of dozing. Okay, so the first one is sitting and reading. What is the chance you're gonna doze off? Okay. Sitting inactive in a public place like theater or meeting or something like that. So it's never doze, slight chance, moderate, or high chance. Okay. As a passenger in a car for an hour without a break. Okay. Lying down to rest in the afternoon when circumstances permit. Yeah, I know. Most people at work. Yeah. Okay. Sitting and talking to someone. Alright. Sitting quietly after lunch without alcohol. In a car while stopped for a few minutes in traffic. Okay. Right. All right. Thank you. Okay. Next, I'm gonna ask you about your other problems with sleep, but we need to check if how often does this happen to you, okay? Alright, so When trying to sleep, how often do you experience the following? Difficulty falling asleep. So, is it daily, weekly, monthly, rarely, or never? Okay. Trouble staying asleep. The same. Daily, weekly, monthly, rarely, or never. Repeated awakenings. Alright. How often do you experience waking up too early? Yeah, okay. How often do you experience snoring or trouble breathing? Again, daily, weekly, monthly, rarely, or never. Choking or gasping for air. Okay. Morning headaches. Dry mouth. Okay. Fall asleep at work. Okay. Have others say you stop breathing at night. Sleep talking. Sleepwalking. Okay. Leg, arm, or body jerks. Tired or crampy legs when you're waking. Okay. Unpleasant feelings in arms or legs just at night. Other bothersome behaviors. How often do you experience irresistible desire to move legs? Kept awake because of bad partner. Okay. Muscle weakness during intense emotions. Intense visual images when falling asleep or waking up. And again, also about how often the things happen, but related to waking up from sleep. Okay, so when waking up from sleep, how often do you notice the following? Again, daily, weekly, monthly, rarely, or never. Coughing or choking. Shortness of breath. Okay. An irregular or rapid heartbeat. Okay. Nasal congestion or runny nose. Okay. Stomach acid taste. Heartburn. Dry mouth. Headache. Anxious or panicky feeling. Right. Legs, arms, body moving or jerking. Right. Bed covers extremely messy. Momentary confusion. Vivid or frightening visual images. Alright. temporarily unable to move your body. Okay. Alright, now let's talk about some daytime symptoms, okay? Alright. So during the day, when you want to be alert and awake, how often do you experience feeling tired even after a full night's sleep? Again, daily, weekly, monthly, rarely, or never? Okay. Struggling to stay awake? Right. Difficulty concentrating? Okay. Dozing off even for a second? Okay. Trouble remembering? Right. Stress, anxiety, or sadness? Avoiding social situations? Not enjoying fun activities? Right. Daytime sleepiness? Sudden muscular weakness with strong emotions? Okay. Alright, thank you. Okay. Now I'm gonna ask you about your sleep-wake schedule. So questions about sleep and wake schedule help us to recognize patterns and that they can vary from day to day, so it's okay if you're not very exact. You just do your best estimates, okay? Alright. So do you keep a fairly regular schedule, yes or no? What time do you usually go to bed? Okay. And what time do you get out of bed? Okay. Once in bed, how long does it take to fall asleep? Once asleep, how many times do you wake up? Okay. How much lost sleep from awakening in minutes? Okay. What is typical number of hours? Okay, okay. What usually causes you to wake up? Right. Okay. What time do you... Okay, we had this question before. So total, what do you think is the total number of hours of sleep at night? Okay. Do you awaken refreshed and ready to begin the day? Always, almost always, sometimes, rarely, or never? Okay. Gotcha. Okay. How long does it typically take until you're fully awake? In minutes? Okay. How often do you take naps? Daily, a few days a week, a few days a month, or rarely, never? Okay. So if you nap, how long are your naps? Okay. When you're free to choose your own schedule, vacation, like on vacations or weekends, etc., when do you prefer to go to sleep? What time? Okay. And when do you prefer to wake up? Okay. So my next part of questions is about some substances. So many of them can affect sleep. So we're gonna talk about the use of some of these substances over the last month. Okay. So if you drink caffeinated beverages like coffee, tea, sodas, etc., could you tell me your daily consumption? Just an average, okay? On weekdays and on weekend. Alright. Yeah, tea as well. Soda drinks, like cola or something? Yeah. Okay. And on weekends? If you drink alcoholic beverages like wine, beer, liquor, and other, also could you list your daily consumption? Okay, only weekends. Okay. Could you estimate how much? Okay. If you use tobacco products like cigarettes, cigars, chew, or anything else like that? No. Okay. Have you ever tried any drugs? Yeah, including cocaine, marijuana, LSD, ecstasy, all of those, they can affect sleep. Okay. Alright, so also a couple of questions about your general medical history, if that's okay. Do you currently have, or have you been diagnosed with high blood pressure, heart disease, heart attack, kidney disease, neurologic disease, stroke, anxiety or panic disorder, elevated cholesterol, lung disease, abnormal heart rhythm, head trauma or concussion, seizure disorder, thyroid disease, drug abuse dependence, diabetes, liver disease, immune disorder, arthritis, depression, alcoholism. Is there any other health problems that you would like to mention? Okay. Alright. Did you have any surgeries or hospitalizations? Alright. Okay. Alright. Could you let me know if there are any medications, including also vitamins or herbs, supplements that you've taken in the last months? Also, both prescription and over-the-counter medications. Okay. So, okay, what is the dosage? And how frequently? So, and why are you taking those? Okay. And do you remember when you started taking them? Alright. Any other? Could you spell that for me? You can't. That's okay. Okay, and dosage? Alright, and the frequency? And you're taking them because... Right. Also, when you've started taking them? Okay. Do you have any allergies, side effects, or reactions, other reactions to medications? You don't know any. Okay. Okay. Now, do you experience any of the following? Headaches, visual problems, vision, nasal congestion, difficulty swallowing, chest pain, heart palpitations, wheezing, coughing, okay, abdomen discomfort, diarrhea, constipation, pain in muscles, skin problems, feeling depressed, feeling anxious. Alright. And if you're aware, are there any blood relatives who had or have some sleep problems, or like they're snoring, or they have insomnia or any other sleep problems? Okay, snoring, yeah. And are there any blood relatives with psychiatric disorders you're aware of? No. Okay. Alright. I think we're good here. Let me just have a quick look. Yeah, I know that was quite a long form to fill, but yeah, but this is really helpful for our sleep doctors, so they can help you, they can prepare the program for you to help in your sleep. Right. Okay, I think we are all good, so I'm just gonna send your form to the doctors. And okay, so how about Tuesday 10 a.m. does it work for you? Okay, 10 or 10:30, just a moment, or 11 o'clock. So it's gonna take about 30 minutes to an hour. Yeah, beautiful. Okay. So 11 o'clock on Tuesday. So we're gonna send you a text message, a reminder of your appointment the day before. Alright? Okay. Beautiful. Alright then. Have a nice day, and see you on Tuesday, 11 a.m. Thank you. Bye.